Hello friends, nice to see you again. Let's enjoy Dr. Y's Chest Radiology. I'm Dr. Y, Medical Professor, Chest Radiologist, Seoul, Korea. Chapter 65, Lung Cancer as an Obstructive Pneumonitis, Part 2, X-ray and CAT scan findings. Let's go! Today, we're gonna enjoy the radiologic findings of lung collapse, combined collapse, 2 lobes or 3 lobes due to lung cancer. Let's go. This is the first case of old man's chest radiograph. What do we see? Yes, we see 2 oblique lines in right lower medial portion. One is dense and the other is denser. And also we see the darker right upper lung zone than left lung and not clear visualization of right hilum and even obscured right diaphragm medial portion, right? Let's enjoy the side-by-side images of a frontal radiograph and coronal contrast enhanced CT. Double white arrows indicate the lateral upper margin of right middle lobe, that is, minor fissure, and dark black single arrow indicates the lateral portion of right lower lobe, that is, right major oblique fissure. And what about the yellow arrow? That is the indication of tumor, lung cancer, and bronchus intermedius. So, obstruction of bronchus intermedius makes the combined collapse of right middle lobe and right lower lobe. Let's enjoy the second case. What do we see? What's the difference or similarity with the first case? This is also combined collapse of bronchus intermedius. More displacement of fissures to the inferior medial portions and almost complete disappearance of right hemidiaphragm. We see only one diaphragm, left diaphragm on the lateral filum, and obscured in slanting image of right hemidiaphragm. What made the difference of chest case number 1 and number 2? Let's compare the non-contrast axial CT, axial PET-CT, and bronchoscopic findings of squamous cell carcinoma in bronchus intermedius. Complete, near complete collapse of right middle lobe and right lower lobe. This axial CT image is a little lower than the previous image. Single arrow indicates the lateral border of minor fissure, upper lateral margin of complete collapsed right middle lobe, and 2 arrows indicate concave, completely collapsed right lower lobe major fissure. Squamous cell carcinoma involving right bronchus intermedius showing combined collapse of right middle lobe and right lower lobe. You showed me your warm heart, expressing good and subscription. Merci beaucoup. Third case, old woman. What do we see? Total haziness of right lung zone. No pulmonary vessel visualized, no airway visualized, no right diaphragm visualized, no displacement of mediastinum and heart. How far can we trace the large right airway? Proximal right upper lobe bronchus, proximal right bronchus intermedius. The catheter is biphysient. The coronal CT shows us how big the tumor is from distal main bronchus and almost all of the right lobes, 3 lobes replaced with a tumor involved with lung cancer, and the peripheral portion is also filled with pleural fluid and showing us enhancing pleura. These two actual images show us complete replacement of right lung with tumor and subcarinal lymph node involvement with peripheral pleural effusion. Number 4. What do we see with this old man's frontal radiograph? Total haziness of left lung, no pulmonary vessel, no air bronchogram, and no visualization of left diaphragm, but stomach gas is telling us the diaphragm is elevated, and left side shift of heart and mediastinum. These are all telling us left lung collapse. And finally, let's trace the left large airway. Where do we find the blind pouch of the large airway? Distal left main bronchus. That is the tumor focus. Coronal contrast enhanced CT film shows us the arrows are telling us the extent of tumor and the more peripheral portion of lung collapsed, surrounded by left pleural effusion, mediastinal shift to left, diaphragmatic shift to upper. Yes, all suggest us tumor with total collapse of left lung and volume decrease on left side, squamous cell carcinoma in left main bronchus. Where have all the young men gone? Who are the young men? They were American soldiers, went to Korean War and died in Korea. Very sad stories. We are always thankful for them who died, who fought for Korea. Thank you very much. Where have all the Marlboro men gone? They are gone. They are dead. Most of them dead due to lung cancer and COPD, most probably due to Marlboro cigarettes. Please don't smoke. Thank you. Thank you for your watching Dr. Y's Chest Radiology and learning and not smoking now. Merci. 감사합니다. See you soon.